January is National Blood Donor Month, and the time is now to roll up those sleeves as the need for donations is the highest it's been in more than a decade. And joining us with more on this urgent need is Dr. Pompey Young, Chief Medical Officer of Biomedical Services of the American Red Cross. Good morning, Doctor.
Good morning. Thank you for having me.
No, of course. We appreciate your time this morning because we're seeing the headlines in the news about the shortages and what the need really is right now. So what is that current state of the nation's blood supply?
Our blood supply is at a critical level. This shortage is the worst we have ever seen in well over a decade, and it's posing risks to patient care. We have limited how much blood we can send to hospitals, and often can't supply all that they need. Sometimes we can only supply 75% of what they're requesting. And what that means is that doctors are having to make difficult decisions on rationing that care, who gets the transfusion, and who has to wait to receive that necessary blood transfusion.
How has the pandemic really upended being able to go in and really donate, especially as Omicron surges and we dealt with Delta early last year?
Right. Well, throughout the pandemic, we have had a lot of challenges with ensuring that we can collect enough blood. Donor show rate has been lower throughout the pandemic, but it's particularly true right now with the surge. We're seeing really a lot of drive cancellations. We're seeing reduced donor show rates. We're seeing staffing challenges. And on top of all of that, we don't fully know the impact as cases continue to rise. Despite the pandemic, it's important to recognize that the need for blood has not gone down. We still have to take care of patients with cancer and sickle cell disease and trauma and other critically ill patients. So the crisis is, the worst it's ever been.
And with that surge currently, and how can you really assure the public that might be questioning whether if it's the right time to really give blood right now? What do you like to say to those who may not feel that it's not safe right now?
Well, throughout the pandemic, the safety of our donor and staff has been one of our top priorities. And we've put in a number of mitigations to ensure that this is a safe process. First, we collect blood only from healthy donors who are feeling well. Additionally, as an added measure of safety, we require masks of all donors, all staff, anyone associated with a blood drive, regardless of vaccination status. Another important point is that whether, even if you've been vaccinated, you are eligible to give blood.
And as a doctor, I'm curious, can you tell us about how waiting for blood products can really impact patients?
Absolutely. So doctors are making those difficult decisions. One of the examples that I can share with you is about a cancer patient, a young man who needs additional chemotherapy for his leukemia, but is unable to get that because he doesn't have the necessary blood counts that he needs to make sure that he can safely receive that chemo. So he's having to postpone that chemo until we can get more blood on the shelf and he can receive that transfusion. So transfusions are often very important to other critical therapies such as transplantation, cancer therapies, not only just people who are so critically need that the transfusion itself is life-saving.
So get us started. If we want to help right now, where can we go to do so?
Absolutely. You can download our app or go to redcrossblood.org, or you can call 1-800-RED-CROSS to identify the nearest drive and schedule an appointment. And please remember that if you can't schedule an appointment immediately, like within a day or two, please try to find an appointment a couple of weeks out or even a month out, because blood cannot be stockpiled, cannot be manufactured. It has to be collected from volunteer blood donors, and every donation is important and will go to save a patient's life.
You said it right there. These donations save lives. So Dr. Young, we appreciate your time this morning.
Thank you. Thank you for having me.
Of course. For more information and opportunities to help, just visit redcrossblood.org like she mentioned. We'll also have all of these details available on our website as well.